In this podcast episode, Dr. Cameron Chesnut, a board-certified facial cosmetic surgeon, discusses the intersection between cosmetic surgery and biohacking in the pursuit of optimal health and appearance. He emphasizes the importance of looking and feeling one's best while also focusing on overall health and well-being. Dr. Chesnut delves into the complexities of male and female pattern baldness, highlighting the multifactorial nature of the condition. He explains that thinning hair is often the first sign of hair loss, which progresses to hair follicles miniaturizing and eventually going dormant. While reviving dormant follicles is challenging, treatments like platelet-rich plasma injections and fat-based stem cell therapy can help stop or slow down hair loss and promote hair regrowth. Dr. Chesnut utilizes fat-based stem cell therapy to rejuvenate the scalp and promote hair growth. By harvesting stem cells from the patient's own fat deposits, he can inject them into the scalp to improve microvascular circulation and stimulate hair follicles. This approach not only addresses hair loss, but also enhances the overall health and vitality of the scalp. In cases where hair loss is more advanced, hair transplant procedures may be necessary. Dr. Chesnut explains that hair transplants involve transferring hair follicles from the donor area to the recipient area on the scalp. To ensure the longevity of transplanted hair, optimizing the recipient area through regenerative treatments like fat-based stem cell therapy is crucial. This helps create a fertile environment for the transplanted hair follicles to thrive. When it comes to topical treatments for hair loss, Dr. Chesnut recommends minoxidil and finasteride as vasodilators that increase blood flow to the scalp. Additionally, peptides like GHK-Cu and BPC-157 can support hair growth and regeneration at a cellular level. These peptides work synergistically with regenerative treatments to enhance the effectiveness of hair restoration therapies. Dr. Chesnut emphasizes the importance of optimizing overall health and providing the necessary substrates for hair growth. By ensuring adequate nutrition, vitamins, and proteins, individuals can support the health of their hair follicles. Combining regenerative treatments, topical solutions, and peptides can further enhance the results of hair restoration therapies and promote long-term hair health. Dr. Chesnut dispels the myth surrounding collagen intake, emphasizing that ingested collagen gets broken down into amino acids and does not directly contribute to collagen production in the skin. He highlights the importance of elastin in skin elasticity and the role of regenerative medicine in promoting elastin synthesis for anti-aging benefits. Dr. Chesnut prioritizes mental and physical preparation before surgeries to ensure optimal performance. He follows a meticulous routine involving visualization, hyperbaric oxygen therapy, sauna sessions, and asymmetric bilateral exercises to enhance cognitive function and spatial awareness. By achieving a flow state, he ensures peak performance during surgical procedures. During surgeries, Dr. Chesnut integrates fat-based stem cells, platelet-rich fibrin membranes, and targeted IV nutrition to promote healing and reduce inflammation. He avoids opioid use and utilizes local anesthesia and long-acting nerve blocks for pain management, ensuring a safe and comfortable postoperative experience for patients. Dr. Chesnut recommends personalized IV therapies with vitamin C, glutathione, and methylated B vitamins to support recovery. He incorporates pulse electromagnetic field therapy to reduce swelling, enhance cellular regeneration, and optimize healing at a cellular level. By addressing inflammation and promoting cellular health, he aims to accelerate the healing process and improve overall outcomes. Dr. Chesnut discusses the concept of perception drift, where individuals may undergo gradual changes in their appearance due to repeated filler injections. He highlights the importance of understanding facial aging and the potential risks of excessive filler use, which can lead to distorted facial features over time. He emphasizes the need for a balanced approach to cosmetic procedures to maintain natural-looking results and avoid overcorrection. Dr. Chesnut explains that the key to achieving optimal results in facial rejuvenation lies in understanding the core components of the face, particularly the amygdala-like part of our brain that is responsible for emotional regulation and facial recognition. By focusing on areas such as the eyes and lips, which are highly expressive and play a crucial role in how we perceive beauty, Dr. Chesnut is able to target specific features that can have a significant impact on overall appearance. When it comes to facial procedures, Dr. Chesnut sees a wide range of patients seeking both surgical and non-surgical interventions. While traditional facelifts and eyelid surgeries are common among older patients, he also works with younger individuals looking to address early signs of aging. By focusing on minimally invasive techniques and personalized treatment plans, he is able to cater to the unique needs of each patient, regardless of their age or gender. As a proponent of laser technology, Dr. Chesnut incorporates lasers into many of his procedures to enhance skin quality and address a variety of concerns, such as pigmentation, redness, and laxity. By customizing laser treatments based on each patient's specific needs, he is able to target different chromophores in the skin and stimulate collagen production, leading to improved texture and tone. While some lasers may require downtime, Dr. Chesnut prioritizes results-driven outcomes that prioritize long-term skin health and rejuvenation. One of Dr. Chesnut's key principles is to educate his patients about the procedures they are considering and set realistic expectations. He highlights the significance of understanding the recovery process, potential downtime, and the expected outcomes before undergoing any treatment. By providing thorough pre-consultations and ensuring that patients are well-informed, he aims to prevent dissatisfaction post-procedure and help patients make informed decisions about their cosmetic treatments. Dr. Chesnut is a proponent of cold plunging as a way to enhance mental toughness and recovery. He shares his personal experience with cold plunging and highlights its benefits for physical and mental well-being. By incorporating cold plunging into his daily routine, he challenges himself to overcome discomfort and build resilience, which translates into other areas of his life. When asked about what it means to be the ultimate human, Dr. Chesnut reflects on the importance of knowing one's goals, values, and mission in life. He emphasizes the need for self-awareness, continuous growth, and the ability to adapt to changing circumstances. By aligning one's actions with their values and striving for excellence in all aspects of life, he believes that individuals can become the ultimate version of themselves.